Hi, I'm Johan Besser. I'm a bioethicist and medical educator. And I want to say a few words about my paper that's appearing in the American Journal of Bioethics in March 2020. This paper is on beneficence and wellbeing. One of the principles of medical ethics is beneficence, that clinicians have to help their patients. Now, beneficence or benefiting somebody means making them better off, improving their well-being. And so if you think about well-being, people have sort of offered two ideas of what that is. One idea is that well-being depends on the individual's view of the good. In other words, the individual has goals, values, wishes, and how well they're faring relates to the individual's own assessment of their goals, their own good, that kind of thing. The other conception of well-being is an objective conception where you have a list of things that constitute well-being, and we can measure somebody's life and see how well they do. Now, on such a list might be things like relationships, health, their happiness, their self-determination. And we can see how well somebody is doing by measuring them using this list. So there are subjective and objective conceptions of well-being. But what I notice in medicine is that clinicians seem to appeal to both depending on the situation. Sometimes benefits relates to what is important to the patient, and sometimes benefits is sort of objective, things that it doesn't really matter what the patient thinks, this is in their interest regardless. And what I noticed was that we need a conception of well-being in medicine that can cope with both of these ideas. And that's what I develop in this paper. I use clinical scenarios, explore clinical scenarios, and develop the conception of well-being that can be used to generate what counts as a benefit for a patient, drawing on both what's important to the patient and objective notions of benefit. I hope you'll enjoy the paper. Thank you for listening. I'm Johan Besser.